asked to vote for us. And I said, hey, we won. All the comments on Facebook were like, duh, of course you won. We love you. I mean, it's not about me. It's just every day we wake up and we purposely set our minds to want to love on people, take care of them, because so many people have been physically abused, emotionally abused, mentally abused, and they really can't find a place to come. And we realize that we know who's walking in here. We know this is a body, this is a mind, this is a spirit that needs healing. And we address that, and our most powerful tool is love first. And that's our key to success, loving people.
I just want to show you that video because it's cool. It saves about 5 hours off of what I want to say to you. So literally, we've been here since 1992. I've been in practice since 1991. So we've been here a long time. And so I want to explain to you what we're going to be doing tonight so that when you see your x-rays, you have an idea what you're getting yourself into. This is called the doctor's report. The reason for this is that when you walk in here, this place is weird enough. And so I want to make sure I explain how we're going to get you better and get you stronger so that when you see your x-rays, you'll know exactly what you're looking at. You'll know exactly what care plan you want to pick for how fast you want to get better. You'll know exactly what it's going to cost you. Then you simply go home and decide on which care plan you want to do. And then when you come back tomorrow, we'll get you started. You'll basically be able to tell them what plan you want. And you'll know what that's going to cost and how that works each month for you. And we'll take good care of you. You'll know what insurance does if you have it. You'll know what it doesn't do if you still have it, but it doesn't work for you, okay? So this is kind of like the welcome orientation, most important class I have for you, okay? This is my Army truck. I call him Big Joe. He reminds me that ever since 1991, I've been on a mission to rescue people from their pain and from any unnecessary suffering that's going on in their life. That's my job. It's taken me all around the world, but that's why we have our Army truck. Okay? That's Big Joe. And here's the thing. In this office, we talk about God. Not as a religion like that, but I just need all the help I can get to help you get better and help us have fun. But here's the thing. Since 1991, I was doing some my wife calls it stupid math. Excuse me. I've given over easily, this is lowballing, over 500,000 adjustments in my career so far, all around the world, okay? Africa, London, Brazil, Tokyo, Paris, North Glen. And so, I don't know everything, but I've learned a lot about what not to do and what to do as far as helping you be strong and healthy, okay? I don't know very many chiropractors in our city that can say they have that much experience, per se, okay? And then that's Kayla Harrison, two-time Olympic gold medalist. Any MMA fans? Right now she's 10-0 in the MMA world. Brutal, fierce competitor. Never get in the ring with her. Jesse has, because he's a judo player, not me. My job is to help her win gold medals, okay? Now here's the thing about Olympic athletes, really good ones. They can see any doctor they want to see. They can go to any massage therapist. They can go to any acupuncturist. They can go to any nutritionist. They can go to any exercise physiologist or exercise psychologist, any medical doctor they want. But when she saw and heard and experienced what I do as a doctor, she wanted me. She wanted us to take care of her and help her stay strong so that she could have a chance to go out and win gold medals. So what we do here is a little bit different. Now the question is, what is your gold medal? What do you want to be doing in 6 months that maybe you can't do now? Or in a year or 5 years, right? That's the kind of doctoring I do. I want to help you win your gold medals, and I'll tell you exactly how that happens and how it doesn't happen. So, there's 3 kinds of health that you can have. The first one is called green grass health. That means you have a strong nerve supply. Okay? That's important to remember that. Strong nerve supply. That's what you want. Okay? You have a strong body, strong mind, strong spirit. You're at your ideal weight. Medications are unnecessary. Shots are unnecessary. Surgery is unnecessary. I'm not against those. If you have an emergency, fine. Get a shot. Have surgery. Take the medication. But again, I would like you to be so healthy that you don't need that stuff. Or if you do need it, it's only for emergencies. Does that make sense? Does that make sense, Carl? Okay. Hey, life is good for you because you have a strong nerve supply. That's what makes you green grass healthy. The second kind of patient that I see walk in the office here is what I call, they have brown grass health. That means they have weak nerve flow. They're in pain some days they're not, right? But they're on medications, they're getting shots, they're getting surgeries for the pain or the condition. Life is hard, life's not fun. They feel broken sometimes and life's not okay. And again, the reason why this is happening is because they have a weak nerve supply. The third person I see sometimes is dead grass health. That's where they have no nerve flow. They stop trying. They have no hope. They don't care anymore about life. They're over-medicated. Their organs are shutting down, okay? Their systems are shutting down. They're maybe getting ready for a nursing home, or they're already on life support, kidney dialysis, things like that, because they have no nerve supply going through their body parts. So these are the three kinds I see. My kind of doctoring, what I want to do for you, bottom line is to get you to green grass health. To get your nerve flow and your nerve supply as strong as possible so that you're strong. That's what I do. That's what I've been doing since 1991, right? That's what Kayla Harrison wanted. That's what gave us success, because that's what I do. Here's the problem, though. Out there, what do we see more of? Green grass healthy people or brown grass, dead grass healthy people? What do you see more of? I've blown you away. Thank you. You would see more of this. Now here's the question I would be asking myself. Why do I see more of this? Why am I here? And what do I got to do to get over here? Or what do I have to stop doing that put me here so that I can get over there? Because it's confusing. And guess what? It's not your fault. They don't explain things very well when it comes to the world of health, right? So where are we going to find green grass health for you? Are we going to find it by going to church more? Okay? Are we going to find it by going to the hospital more? Are we going to find it by taking more medications? Right? Are we going to find it by eating really weird food? Right? Are we going to find it by going to the gym and doing more burpees? Again, we're trying to find green grass health when the whole world can't find it, right? Are we going to find it by laying down and letting somebody crack your back? Here's the thing. If we have more brown grass, dead grass people in our society, and yet we have more of this in our world, in our city, in the United States, the problem is that we're doing more of all of this, and yet we're not finding more health, green grass health. And here's the reason why. If I don't feel good or I'm sick and I go to the doctor, medical doctor, what are the three options he or she will give to me? And again, my mom and sister are both nurses. I'm not anti-medication, but they only have 3 rules to follow. If I don't feel good, what are they going to give me? Sorry. Smoke's getting to me. What's the first option? Antibiotics, so medication. And if medications aren't working, they give you what then? A shot of something. And then if that's not working, then they figure out what body part do we need to take out or do surgery on, right? That's the 3 options. Those are the only 3 options your insurance covers. Those are the only 3 options they get paid to do. Anything other than that, just not in their wheelhouse. And again, if it's an emergency, I'm okay with that. But here's the thing. The question is, do you need more medication, more shots, or more surgery to win your gold medal? And the answer is no. Here's the reason. It's all about nerve supply. Medication, shots, and surgery do nothing to boost your nerve supply, your nerve flow. They actually diminish it and shut it down. So, when your only option is living in a drug-free America, that may be a reason why you have never reached green grass health yet. There's your antibiotics the day you're born, right? all the way to after age 65, they got a pill for every ill. Now, I'm okay if you're in an emergency situation. I'm not okay if they say, take that for the rest of your life and you're never going to get better. That's not okay. Because here's the result. Here's the outcome. Is this working? You said no because there's more brown grass, dead grass people out there and not enough green grass people. But here's the result. A lot of this doesn't do anything to the nerve supply, and more of this simply causes this. Over almost 10% of the United States population has diabetes now. 1 out of 4 people die of heart disease as of back in 2010, so it's probably worse now. And 1 out of 2 men and 1 out of 3 women at some time are going to be told they have cancer. So if the shot and the surgery and the medication plan was working to be healthy, then why are these numbers so bad, and why do we get an F? Does that make sense? I'm not picking on anybody. I'm just simply saying this is where you live right now. I need to help you be strong and be healthy, and we've got to do it a better way than what you've been getting. Are we okay with that? Now, because this is where America's health is going right now, and you see that. Again, we look out there, you see numbers going up. They tell you, well, and again, I usually don't talk about it, but the whole COVID and all that stuff, what do they say? Well, if you're really unhealthy, you've got comorbidities, you got a bunch of things going on, you're more susceptible. Yeah, if you're brown grass or dead grass, then you're going to get sicker more. You're going to get sicker faster, and it's not going to be pretty. But if you're green grass and you're strong, guess what? You don't have any problems. So I don't want this to be you. And I don't want you getting any more giant emergency room bills because your body's in brown grass, dead grass state. This lady had horrible headaches. She went to the emergency room. She was there 2 days. Sorry. She gets me choked up. She left the hospital 2 days later. Doctor says, I don't know what's wrong with you. Here's more medication. Follow up with your primary doctor. Go figure it out. But then they gave her a bill for $45,486.97. So for $45,000, did they do anything to make her green grass healthy? Yes or no? No. But they want her to pay that bill. Not a good way. So if you have insurance and you're hoping they pay for you to be healthy, they don't. They pay for this. They pay for when we're green grass, when we're brown grass or we're dead grass. So that's my whole insurance part of the talk there. Okay? Every dollar you spend here is going to move you to green grass health and be strong, because we focus on nerve flow. Here's the rule. You can't medicate your way out of a problem that nerve flow or you behave yourself into without knowing. So that's why we got to change the rules. And so, okay. Here's the rules. If I take grass seed, okay, it's grass seed. I put it in the ground. I water the grass seed. In time, if I give a good water supply or a good water flow to the grass seed, what will that grass seed release and do for me? It'll grow, right? I get real spiffy because you know how to grow all that stuff. Yeah. So it gets real, it grows. Now, here's the thing. How does the grass seed know how tall to grow? Or how does it know to turn green? Genetics. Where are the genetics at? In the seed. The seed knows everything it needs. You just give it enough water supply and enough water flow, and it already knows what to do. It's not rocket science. Well, maybe it is to a certain point, but okay. But, so here's the thing. Now, if I kink the hose and I turn down or I mess with the water supply or the water flowing to that seed, what's going to happen to the green grass then? Here, I'll help you out. Real simple. It's going to go to brown. It's going to go to brown grass. So if I kink the hose, I mess with the water flow, I mess with the water supply, that green grass is going to react, it's going to go to brown grass. If I keep it kinked, right? Did you do this for the city of Westminster, or you utility stuff, water? No?
I have a hard time.
Okay, so when you worked for the city of Westminster, you worked utility, right?
Right,
So what were you in charge of?
utilities,
And what did that mean? That's a, like,
water plant.
okay, yeah, so you need water, right? I'm
Right.
talking your language then, that's what I thought. So if I don't turn the water supply back on and the water flow stays off, the water supply stays off, then the seed goes from green to brown to dead. It's in its seed, it's in its genetics, that's what it's supposed to do. You give me the flow, then you're going to be green. You take away the flow of the supply, then I got to shut you down. I'm sorry, I don't make the rules, that's just how it works, right? So that's how the body, and that's how the body works as well. And so what your garden hose is to your grass, your spine is to you, to your seed. Okay? It's all about nerve supply and nerve flow, right? This is your spine. It has to be straight like this if you want the nerve flow to be, and the nerve supply to be strong. When you look at your posture from the side, it has to have 3 good curves, just like your grandmother told you, right? Nice and tall. If anything shifts in your posture, that kinks the hose, and that messes with your nerve supply, and that messes with your health, right? If you have forward head posture like this, and you kink the nerves, or you lose your lower back like this, you kink the nerves, then you mess with the nerve supply. You mess with the nerve flow, and your body has to react by building sickness and disease. That's how it works. That's how it works. So it's all about your spine and the nerve supply or the nerve flow. Got me so far? Okay. Now here's the good news. I almost forgot the good news. If the hose is kinked to the grass and it's turning brown or it's dead, and I take the kink off the hose and we turn the water supply back on, we turn the water flow back on, what will that brown grass, dead grass do? Go back to green, right? And then once you get it green, how long do you want to keep it that way for? Say it. Say it. There you go. Forever. I didn't. So you're like, well, duh. The point is that that's the kind of doctoring I do. Metaphorically, right now, you have this going on in your spine. It's been shutting down your nerve flow and your nerve supply for a very long time. That's the reason why you feel the way you feel, and your life's been the way it is. My job was to find this on the x-ray. I'm going to show you where it's on the x-ray in a minute. Take the kink off the hose so that that nerve supply, just like the water supply, can get turned back on. And your brain, that's the seed, it knows what to do and to make you strong again. Okay? So the healer's inside you. Not a shot, not a surgery, not a bottle of pills. We don't need more of that. So, now, again, real quick, this is your biology lesson 101. Well, Dr. Joe, can I just change my diet? Won't that give me better nerve supply, make me lose weight? It might, but you can go 30 days without food. So it's important, but not like life or death, right? Water actually is more important to you than food because you can only go a few days without water, right? But air is more important than water because you can only go minutes without air. Anybody watching anybody a fan of the Paralympics? Anybody ever watch the Paralympics? Do you know the difference between an Olympian like Kayla Harrison and a Paralympian? The difference is nerve supply, nerve flow. The minute someone's brain or body part loses nerve supply or nerve flow to it, it goes dead or spasms. But it no longer works. So in the hierarchy of your body, I have to go after your spine and nerve flow first, not because I'm a chiropractor, but because I'm a doctor who understands how to get your body healing and get your body strong. Because again, I can do all kinds of fancy fertilizers, but if I don't get the water turned on, it's not going to happen. So that's why I go after the nerve supply first, because that's what's going to bring your life back to life. That's what's going to bring your emotions back to life, your organs back to life, your muscles, your strength back to life is your nerve supply and your nerve flow. That's why it starts first. Again, conception, from the day you're conceived to the day you're born, is all about nerve supply and nerve flow. This doesn't happen without nerve supply or nerve flow, right? Your heart beating right now is all about nerve supply, nerve flow. If you have a good, strong nerve flow, then you're going to have a good, strong heartbeat. Healing, any kind of healing, whether it's a cut or anything in your body, is all about strong nerve supply, strong nerve flow. Okay? And then here's where the nerve supply, nerve flow lives. Your brain is the power source. It supplies down the spinal cord. Then the power flows out through the nerves to every part of you. That's how it works. This is in charge of all your happiness, all your healing, everything you want about life comes from the nerve flow off this spinal cord. We start here first, then everything works better. So, again, if you want a strong life, strong nerve flow, strong nerve supply. When you have a strong nerve flow, a strong lifestyle, then you have the best immune system to fight off whatever's going on out there or anywhere else, right? You have a good, strong digestive system. You can eat better foods, what you want, right? Not necessarily hot, spicy Cheetos, okay? I'm not saying that. I'm just saying you got to be able to, you can be able to eat better. You move better. Your muscles move better. Your joints feel better. You feel younger and stronger when you have a good nerve supply. You have less aches and pains. You have more energy. You have better posture. And you sleep better when you have a good, strong nerve supply. So that's really what we want for you. And here's the cool thing. When you have a strong nerve supply, then you don't have to go to the hospital as much. You don't have to have as many surgeries, if any. And you don't need medication. It's not me saying it. It's what statistics and the data shows. So, when we get your nerve supply strong, then you're going to have more peace in your mind. You're going to sleep better. You're going to feel stronger in your workouts and in your body. Actually, I work out with you on Saturday mornings here at the office. I'll teach you how to train and how to get strong and how to get in shape no matter who you are. We've got bands. I got seated exercises, standing, bands, everything. We'll customize your diet so that with a good nerve supply, then your diet's better for you. Then we'll talk about whether you need vitamins or not and how to protect it. Then if you need emergency medicine like that, just let me know. We'll make sure of that. But when we have a good nerve supply, everything works better for you. So, nerve supply is what keeps you green grass. Nerve supply is what makes you brown grass or dead grass. Your x-rays tell me whether you're green grass, brown grass, or dead grass. Not how you feel. Your symptoms don't tell me. That just means brown grass, but I don't know where it's at and then what we need to do to get you better. You can be brown grass and feel okay, and yet your body's making headaches, cancer, heart disease, chronic pain, arthritis, depression, all kinds of things. So we don't want to stay there. We want to get there. Your insurance pays to keep you here. But how did I get to brown grass, Dr. Joe? Why are all these children running around here? Well, because the day you were born, there's a pretty good chance the doctor said, hey, as soon as your head showed, pulled you right out. Or forceps, or vacuum extraction. So 80% of children have a kink in their hose, have a block of nerve supply right after their birth process. And unfortunately, we live in a culture that doesn't take the baby right away. My patients do. I go right to the hospital or to the birthing unit or the home, make the adjustment on that baby, turn that nerve supply back on, and now they're fine. But chances are you've been growing up the last 10, 20, 30, 40 years with a kink in your nerve, and you have a lack of nerve supply, yet no one told you because it's been happening since the day you were born. Now the good news is that we have a computer that scans newborn babies that tells us if they have a strong nerve supply or not. And if they don't, then we begin adjusting them to keep them healthy and strong. But again, x-rays for the majority of you is what we use to look at your spine to see whether you have a weak or strong nerve supply. Okay? And here's how it works. You all sat down, you looked in the mirror. I took an x-ray of this is your neck, your cervical spine right here. And again, yes, you do need geometry. And we used it here. I drew a line off the back of your C2 vertebrae. I drew a line off the back of C7 vertebrae. And it gave me a measurement. Now, this case, 37 degrees. I like that because anything over 35 degrees means you're in the green grass zone. So I can look at your x-rays, I look at your numbers, it tells me right where you're at, okay? The other x-ray I took was the one for you from the front. I had you wear goggles so I can make sure your spine is nice and straight. And I want to see your entire spine right on the red line. If I see him going off to the right like this, is that green grass or brown grass then? Brown grass, kink in the hose. Now you see it. This x-ray here we took is of the one like where you sit with your arms crossed. I'm looking at the lateral curve of your spine. Again, I draw a line off this vertebrae right here. I draw a line off the back of this vertebrae right here. It gives me an angle of 37 degrees. Hey, I like that because that's in the green grass zone. Woohoo! Good strong nerve supply. So your numbers tell me everything. I know right where you are. No guessing. And then from the front view right here, that's what this x-ray looks like. Nice and straight, green grass zone. And once I take your x-ray, if your spine's doing this, that's not good. Weak nerve supply. I put the head weight on you, like the hat we put on you, remember that? And what that does is your brain now begins to pull you back this direction. And then we measure it. So in this case, that 37-degree curve went to 39. So I know when this guy wears 1 pound on his head, we're actually opening up the nerve flow, nerve supply. That's how I know what's going on with you and why you're hurting. That's how I know you're getting better and what's going on with you. It's right there in the numbers. I'll take these numbers more than I'll take a blood pressure, colonoscopy, MRI, CAT scan, or anything. Because if these numbers are bad, that's all going to go bad eventually. Okay? And then how long has it been that way, Dr. Joe? How long has my spine, how long has my nerve supply, nerve flow been kinked or been shutting off? That's what this poster, these x-rays tell me. Normal means you've got good numbers. No arthritis, no degeneration. Phase 2 means that for like at least 10 years, your nerve supply and nerve flow have been pinched off by your spine. So if it's taken 10 years for your spine to get this way, how long is it going to take to get back going towards green grass? Time. Not 10 years, but it's going to take time. Most people, the first 6 months, we get things turned around, get the green grass going, rock and roll. So we can literally undo 10 years of damage and lack of nerve flow in 6 months or less. That's pretty cool, okay? But, so if you're phase 1, you want to stop it from getting worse and get your spine nerve flow back on. But what if I don't find you for a bunch of years and you're already at phase 2, which means you have arthritis and degeneration all over your spine? Stenosis, scoliosis, degeneration, arthritis, all those itises and otises they talk about, right? That just means that for 20 years, the nerve supply has been shut off or turned down, causing brown grass, dead grass to attack your organs and your mood and emotions. So when I see phase 2, that means we've got to stop this from getting worse with the adjustments here and get your spine going the right direction. If I see these bones completely fused together, that means you're at phase 3. We call that nursing home spine. All these vertebrae have fused together over the last 30 years, and boy, we've got a lot of work to do. Some of you will be in here every day for 6 months just trying to stop this and get some things going back the right direction. Okay? So that tells me how long you've been losing nerve supply or nerve function. And so let's talk about this x-ray. I want to see 35 to 45 degrees. In this patient, I see 15 degrees. So therefore, what are her vertebrae doing to her nerves? Clamping down on them, pinching them, blocking them, squeezing them, kinking them, whatever name you want to give it. Bottom line, is her nerve flow strong or is her nerve flow weak? Weak. So if we leave it this way, what's going to keep happening to her health and her life? Better or worse? Worse. So now, how are we going to change it? Oh no, let's give her lots of medication. Is medication going to do anything to make that nerve supply or that spine get better? I'm not against it. It doesn't take the kink off the hose, okay? Or how many shots, or surgery even. Lots of times they don't put the spine back and then screw it back down the right way. So it causes more pinching to occur. So again, I'm not anti-medicine shots or surgery because I'm just saying it's not going to turn your nerve supply on because it doesn't change the x-ray, right? Okay, what about walking into the crack in the box? You lay down, crack, 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 crack. Will that change the x-ray? Not necessarily. So we don't know if it improves nerve supply or not. You might feel better for a little bit, but then it comes back and you got to go back again. You got to go all the time, and you're not even knowing because there's no x-rays. So that's why I don't do that kind of care either. What I do is take this person with a 15 and do something so that when I re-x-ray, it goes to 30, right? Who has more nerve supply? Who's stronger and healthier? The 30-degree curve or the 15-degree curve? The 30. So that's what I do with you. That's the doctrine, to get the nerve supply turned on and get the nerve flow going, right? So first thing we do is we have you drink water so that we can make changes on these discs. They're not dried out anymore. Then we put your spine in a good curve position to turn the nerve flow back on and keep it on. Then we have you wobble. Again, why? Because that just gets the spine open and the nerve flow going. Then we have you lay on a table, and I do an adjustment. Now, with the adjustments, some people like no cracking. Some people like lots of cracking. They see the guy on YouTube pulling stuff, right? I'm just too busy to shoot videos of everybody. I've been doing all that stuff for almost since 1991, all that stuff you see on TV now, right? I probably should start cracking backs and popping zits and stuff, and I'll have 1 million, 2 million followers, right? Don't get me started. I'm here to get you better. But my point is that sometimes I use the adjusting tool, and that will turn the nerve flow on faster than cracking your back. So if you feel like I'm not cracking you enough, just let me know. But really what my goal is to either use whatever I can over here with the tool or with my hands to turn the nerve flow back on. That's really what it's all about. And to make so that when we re-x-ray you, we see good changes on your spine and posture so that you get the green grass health. It's not just about cracking things. Some people don't like it. Some people I don't even have to, like newborn babies, and we get beautiful results because the nerve flow is on. Okay? The nerve supply is on. And then afterwards, we want to keep the nerve supply on, so I'll put the head weights on you, and then you stand on the Vibe platform, which speeds up the nerve supply going to your body. It's a beautiful thing. Now, how are we going to undo 10, 20, 30 years of no nerve supply or weak nerve supply in 6 months? Well, you have homework to do. And if you commit to 6 months of care with me, then you get your spinal brush on your next visit. You brush your teeth, right? Carl, you brush your teeth still? Yeah? Okay, good. This is your spinal brush. So this is how you're going to, after your adjustment, and when you go home, keep your nerve supply strong no matter what kind of day you have. Strong nerve supply, happy brain, strong body. So, you'll learn, we'll teach you all this stuff. I have videos on all this stuff. You'll teach you how to lay on these at night when you're napping or going to bed for the first 20 minutes so you get an amazing sleep and wake up with strong nerve supply. You'll get your own wobble disc on how to wobble every day so that you can keep the nerve supply strong, keep the flow going to all your body parts. You'll have your own traction unit that you hang on a strong door that you do every day so you can keep working on your nerve supply and your nerve flow. And the last thing is, I'll tell you in a minute what your head weights are, 1/2 pound, 1 pound, 2 pounds, and you'll just take this every day. You'll just sit in a chair, put it on your head, sit nice and tall, watch TV for 5 minutes or up to 20, no more than 20, and the whole time you're just getting your nerve supply back on, getting your brain back on, and literally moving yourself into green grass health. And then you said you want to stay there, so whatever you did to get there, this is what you use to stay there. So again, this is part of your kit. You'll get this on your next visit, okay? So that's your home kit. So at home you do your traction, you do your wobbling, you sit with your head weights on, you lay on your rolls. Again, why do we do all this? Because life is all about nerve flow. All about nerve flow. All about nerve flow. And then when we re-x-ray, then you'll see the numbers start going the right direction. You'll see things be getting straighter. You'll see the curve start going back the right direction in your lumbar spine. You'll see your lower spine start getting better. That's what we look for. We look at your numbers, okay? Your head weights, we'll look at your numbers, and we know, okay, there's more nerve flow, nerve supply. These are going the right direction. You're getting stronger. And the cool thing was when we do this, this is what, again, this is what a better nerve supply or stronger nerve flow can do for you. For Pat, she has no more depression anymore. Now she can go to work and smile. For Sue, stronger nerve supply means she lost 25 pounds, which means her A1C went down, which means she no longer has diabetes. That's what good nerve flow can do. Ryan in school, better focus, better grades, better nerve flow, so now you can get a college scholarship. Mike's headaches are all gone now. Why? Because now he's a better nerve flow going to his brain, to his body. No more headaches. So now he's not grumpy with his family anymore. David's off all pain meds. Why? Because he was taking the pain meds because he had no nerve flow. Increase the nerve flow, no more pain, no more need for meds. So now he can go to work and do what he wants to do, right? How about this? Barb's cancer's all gone. Why? Do I treat cancer? No. We just turned the nerve supply back on, and the body took care of itself, and now her doctor says we can't see the cancer anymore because the nerve flow got turned back on. Ron wants to live and not kill himself. Why? Because he had bad nerve flow to his emotions. We turned that back on. Now he's happy. Now he wants to live. And now his family has their daddy back. Mary, able to get pregnant. Why? She had no nerve flow to her female organs. Turn that nerve flow back on to her and her husband too. And now babies are being made. When doctors said it would never happen. Jock's prostate cancer is gone. Again, lower back pain for years. Turned the nerve supply back on. The prostate started getting back to green grass. Now they can't find cancer anymore. It's all about nerve flow, nerve flow, nerve flow. Bill's Parks family are happy, skinny, having fun. Bill's off his blood pressure pills. Why? Because nerve flow runs the heart. You make the heart nerve flow better, then the blood pressure gets better. No need for medication. Elaine, best shape, best mood ever. Why? Again, more nerve supply, better mood, better shape. You actually feel like being green grass strong. I was the chiropractor for the Colorado Rapids when they won their championship way back in 2010. Why? Better nerve flow, better champions, better soccer. Again, our athletes win gold medals. Even at 2020, I wasn't there personally, but athletes that our team works with won gold medals still. So it's still happening after 3 Olympics. Baby Johnny's happy when he wakes up. More nerve supply. Happy baby. No more colic, right? Sleeps through the night. Rob says my legs stop kicking and shaking at night. Jeff says my eyes can see better. Paul's out of the wheelchair, walks on his own, can dance with his daughter at the wedding. Again, if we don't turn the nerve supply, nerve flow back on, all this, these people keep staying medical patients, trying to find the right medication, the right shot, or the right surgery to fix them. We turn that nerve supply back on, that seed goes to work like it's supposed to, and they all now get healthy and strong. That's why you're coming here. That's what it's really all about. So, as I wrap this up, I'm on a mission to help you get better. What are we going to do first? Get your spine healing and get that nerve flow turned back on. Then we'll work on the other stuff. My last question before I show you your x-rays is, what about your family? This is my family. This is my family. This one here had birth trauma, and the nerve flow got shut off, and it caused seizures. Everything you see here was to help her get better so that she doesn't have to have seizures anymore. Right? Nerve flow, nerve flow, nerve flow. This one's studying to be a chiropractor. This one's studying to be a chiropractor. This one, you know, he took your x-rays. This is my wife. But again, is there anyone in your family that should get their nerve flow checked? You've got 2 weeks. I'll pay for it. Get them just like you did. You get them in here. We'll get them x-rayed. We'll get them examined. We'll get a few adjustments. We'll show them their x-rays. And then we'll get them better too. Get the nerve flow going. Okay? So, here's what's going to happen next. I'll take you back individually. We're not going to go together. We'll go back to the x-ray room. Look at your spine on the x-rays. I'll ask you, what do you tell me you see? Green grass, brown grass, what do you see? I'll give you my best recommendations to get the nerve flow back on strong and keep it on. I'll show you your different options. Make an appointment on your way out to come back tomorrow so we can get started and get you your kit. Go home, pick whatever care plan you want. And then your next visit, we'll get started on your journey. Okay? All right. So, hang on here for a few minutes. We'll take you back, Kobe.